today. As we're getting started and getting grounded in the space, we invite you to please share in the chat your name, pronouns, organization, and what your role is in either food waste prevention, food rescue, and/or food scrap recycling. And we'll go ahead and get started in just a minute.
Well, while we're waiting, I'm having fun looking at what's in the chat right now. Welcome, everybody. Claire, it's nice to see you here from Kane County Recycling. Gotten to see you on some of the Illinois Food Scrap Coalition meetings as well. Oh, Maddie's bringing in a national perspective to the conversation coming from Natural Resources Defense Council. Jeanette, I'm wondering how long you've been at Sinai's Urban Health Institute. I used to work at Mount Sinai Hospital and then Access Community Health Network. So glad to see Sinai's name on the list.
All right, Jen, I think we have a great group, so we can go ahead and jump in.
All right, but I did miss saying hi to Anne from Advocate Aurora Health. Got to mention the western suburbs as we get going. All right, thank you everybody for joining us. Keep adding that information in there. A big part of why we're coming together today is to get to meet each other and to learn what hospitals in Illinois are doing to reduce wasted food, to rescue food, to feed people, or to recycle food scraps and return nutrients to the soil. I'm going to ask you, Lucy, to go to the next slide. We have an action-packed morning for you. A lot of experts are coming to share what they're doing to be able to help you see programs that are in place and successfully working in each of these areas. And then we're going to be going into breakout rooms and have experts rotating from room to room. You'll get a chance to ask questions at that point. You'll get to find out what some of the challenges have been that hospitals and health centers have had starting these programs, maintaining these programs. And then we're going to have a discussion at the end about what are some actions that you can take moving forward. Lucy's going to start us off. I'd like to introduce you to Lucy Peterson. Actually, I don't think I introduced myself to the whole group. I'm Jen Nelson, sorry. I work for 7 Generations Ahead, which is a nonprofit that helps build healthy and sustainable communities. I've worked with a number of institutions, including hospitals, to help start programs that reduce wasted food and rescue food. So I am excited to be here. I also help to co-lead the Wasted Food Action Alliance, and the Wasted Food Action Alliance is collaborating with the Alliance for Health Equity, bringing you this event. I'm going to turn it over to Lucy, who can tell you a little bit about the involvement of the Alliance for Health Equity and then some of the work that we've done gathering data. Lucy.
Yeah, thanks, Jen. It's wonderful again to be here with you all today. We're so excited to see partners not only from Illinois and the broader Midwest, but also the national level. We're just really grateful to share space with you. So my name is Lucy Peterson. I use she, her pronouns. I'm a program manager with the Alliance for Health Equity at the Illinois Public Health Institute. We are a collaborative of over 30 hospitals and healthcare systems within Chicago and suburban Cook County who've come together to support the collaborative community health needs assessment process and broader work in supporting hospitals and healthcare systems in addressing social and structural determinants of health. And so a big area of our work is on food access, and that has brought us in partnership with Jen and her team. And we decided that we wanted to send out a survey in 2021 to really understand where our hospital and healthcare systems in Illinois at with their food rescue programs. So we sent out this survey in fall of 2021, and we were enthusiastic to have received responses from a number of different partners across the state. In particular, the partners who we've heard from are listed here. The feedback that we received was really excellent. We got to understand what hospitals and healthcare systems are currently doing with their food rescue programs and where they want to be supported in expanding these programs, starting new programs, connecting with partners. And so that was really the impetus for us coming together today. The survey is still open. So if you are with a hospital or healthcare system that's not listed here on the left-hand side of the screen, we encourage you to please respond to the survey. It not only helps us be able to network with you directly, but again, it will connect you to this broader effort to really support hospitals and healthcare systems in Illinois with their food rescue program. So you can use the QR code on the right-hand side of the screen to take that survey. It takes about 5 to 10 minutes. And we'll also be sure to include the link to the survey in the follow-up from today's meeting. So we did want to share some of the findings with you all as we're getting grounded in this space. So we asked hospitals and healthcare systems about their food surplus prevention programs, their food rescue programs, and if they have any food scrap composting or food scrap recycling programs. So starting with prevention, of the 16 hospitals that responded to the survey, we had 11 indicate that they have current food surplus prevention programs. So these programs could be menu planning programs, smarter purchasing plans, room service, or cook to order, and repurposing food. So across the board, this was the most common program that was being implemented among respondents. And we also had about 44% of hospital respondents indicate that they really like to learn more about preventing surplus food. For rescue, of the 16 hospitals, we had 5 who have current programs and 9 who have not had any current or previous programs. So the most common food rescue program that we saw was the Surplus Project, which we'll have a chance to learn more about today. We also had several partners who donate surplus food to homeless shelters, community-based organizations, and other charities. And we saw that a lot of the food was being rescued from the back of the house, cafeteria, or even from catered events and meetings. And about 50% of hospitals indicated they really like to learn more about food rescuing. And then finally, with recycling or composting, we see this as another area that we can really expand support. Of our 16 hospital respondents, only 5, again, indicated that they have current food recycling programs. And interestingly, a lot of folks are using in-sink garbage disposals, farm animals, they're using garbage or landfill containers, but only 1 hospital reported that they have a current program that focuses specifically on food scrap composting. And again, 50% of respondents said they're really excited to learn more about recycling wasted food. So I think this is another area where we're really excited to talk more today about the different programs that exist and dive into ways that we can support you as hospitals and healthcare system partners and other community-based partners in really strengthening these different types of programs and getting involved in them. So I am really excited to pass it back to Jen, who's going to intro our speakers today and then get us started with food surplus prevention.
Great, thank you, Lucy. I want to just say that this is a packed group of people that you're going to get to meet today. They have been doing work in so many different areas. I'm going to start us off with some facts just about food waste in hospitals and healthcare systems and what some of the avenues that are being taken to help make change do. And then I'm going to leave it to those that are actually boots on the ground doing this work to share their stories. We're only going to do a brief introduction of each of the speakers as they go by, but when you receive the deck, you'll have their name, their bio, their email, so you'll be able to contact them after the event as well, but I'm not going to actually read out the bio. I'm just going to keep it quick for you. We are also not going to do Q&A after each of the speakers. We're going to save that for the breakout rooms. So you are welcome to add questions as we go along into the chat, and we can try and bring some of those back into the roundtable discussion, or we also have our speakers have offered to answer questions afterwards so that we could send out a Q&A report to you guys and be able to share what might otherwise get missed. So without further ado, I'm going to ask you to go ahead and skip to the next slide. I just wanted to talk a little bit about how hospitals end up with wasted food. And I think this is something that if you're working in a hospital or healthcare system, it truly is challenging to figure out just the right balance to be able to meet the needs of patients and staff and visitors, to meet the health requirements of meals. And as with any larger food service one, this is like, it's all a challenge. And part of what you're doing is trying to save costs and keep costs down. And so that's where food waste prevention can really be a benefit. But just know that food gets wasted, whether it's expired foods, overproduction of meals that are being made and served, return patient trays, and then just sort of the poor preparation practices. If you're short on staff and you're short on time in the kitchen, like how are you balancing what's coming in and going out? And so we're going to be sharing a bunch of different ideas for moving that forward. Hospitals generate nearly 30 pounds of total waste per bed per day. And they say that about 10 to 15% of that is food waste. So that's about 3 pounds per bed per day of wasted food. That's average in the US. And so we can really make a difference here. Next slide, please. I'm not going to go into great detail, but I always say you can't really identify the opportunities for change until you know where you are when you start. And so doing a waste audit and understanding how food is traveling through your institution, where there might be opportunities for preventing, rescuing, or recycling food scraps is really important. And Practice Green Health is a nonprofit membership organization that has a bunch of different tools and can connect you to a network of other healthcare organizations doing this. I'm going to take a moment to also say that we do have grant funding to support hospitals in Illinois that want to work on this. 7 Generations Ahead has a very generous funder that has made it possible for me to come in and work with you and have meetings with senior management, have meetings and walkthroughs of kitchen space. And so that's going to be a resource that's available to you following this event as well. Next slide, please. All right, so today we're focusing on prevent, rescue, and recycle as opportunities in hospitals. You're going to hear about each of these different stories, but I didn't want to leave out the fact that hospitals play a very key role in our communities. And what you do has the opportunity to educate staff, customers, visitors, patients. What you're doing in the patient rooms is visible and is known. What you're doing in any food service, whether it's a Panera located on site at Rush or it's a cafeteria where people can go in and get food. These are all ways that you can make a difference and help spread this beyond just your buildings. I also think it's really important that you think about your role as in partnership with community organizations, your role in helping to support the neighborhoods that you serve and the people in those neighborhoods, making sure that there's healthy soil for growing food, making sure that neighbors are getting culturally appropriate, healthy food in their homes too. And most of you are already, according to the survey, many of you are already connected to or thinking about these kinds of food rescue options, but we have some speakers from community organizations who are going to share what this relationship can look like and what kinds of partnerships can be built near you. Next slide, please. So I just I'm going to ask for help. I did not do a comprehensive slide here. There are maybe 50 or 100 different ways that you can help prevent food waste in a hospital or healthcare system, whether it's looking at technology that measures and tracks or looking at dishwashers that grind and then dehydrate. It's looking at how your menus are planned and what kind of dining you offer to people. I would like you to share in the chat if you have something specific that your hospital or healthcare system is doing to prevent wasted food. Start dropping some of those in the chat because we can create a comprehensive list that we'll share out with everybody afterwards. And next slide, please. I am going to just turn it over to the people who are doing this in their hospitals and health systems. Ian Hughes is the sustainability manager at Rush University Medical Center, who had the challenge of coming into this job right at the start of the pandemic. And so looking at how food is being managed and how sustainability practices are sustained during a medical crisis only adds to the challenge. So I would like to turn it over to Ian to share some of the experiences at Rush University Medical Center.
Awesome, thanks. Can you all hear me okay?
Yes.
Great, thank you. Next slide. So my name is Ian. I'm the sustainability manager here at Rush. It's been an interesting 2 years to say the least, but we've started on our food waste journey, I guess. I started, I should say, because our food nutrition services team has been doing some really great work prior to me getting here. So a lot of it was discovery on my part. Next slide, please. A big focus of what we'll talk about today is kind of the measurement side of things, but we will get into some of the other really great practices that we have. Erica can speak to that once we get into those breakout rooms. But just a little bit of background on our medical center. We're 7 city blocks, 20 buildings, 6 million square feet. We've got a central patient feeding kitchen, a FUTA run cafeteria. We have a room 500 for catering and just a lot of opportunity on our campus as a result. Next slide, please. For the sustainability team, we've been here again for about 2 years. We're a relatively new program. We developed these 5 pillars and objectives. And the one in particular that ties directly to and got us connected with the food nutrition's team is our rethinking and reducing waste pillar. And that was a really great way for us to make this bridge to the food and nutrition department and start to have those conversations around wasted food. This is to kind of give another shout out to Practice Green Health, aligned pretty closely with a lot of what they have on their website, the frameworks that they provide for our healthcare systems. Next slide. So getting to know our team was awesome. As I mentioned, they've already been doing a lot of the work in each one of these reduction or minimization or elimination steps in the food reduction or food waste reduction hierarchy. It was really awesome to have the opportunity to volunteer down there and get to know these people. And they are all very, very passionate about what they do. And it's just really invigorating to be around them. Next slide. Just one quick shout out is something that will come up later on. We do work with Franciscan Outreach on rescuing food. And I just want to give them a quick shout out. I won't spend any more time on that because I know they've got a presentation as well. So next slide. It's been a great partnership for us, especially in terms of volunteering opportunities as well. One really quick shout out to the Food Nutrition Services Department. One of the first opportunities we had to collaborate was on the Healthcare Anchor Network's impact purchasing commitment. This kind of doesn't really have a whole lot to do with food waste. I just wanted to give it a shout out. We can talk more about it in the breakout rooms, but one of the 3 areas of focus for this purchasing commitment was on purchasing or procuring food that is notified, or I guess noted as sustainable as by Healthcare Without Harm. So a really, really great opportunity for us as early signers on that. Next slide. And that actually gave us the opportunity to connect even more deeply with the Food Nutrition Services team. We came up with a cohort, again, on the food waste measurement side of things, of folks, kind of a cross-functional collaboration of food nutrition services on the operational side of things. Rush University faculty are supporting this project, as is a whole host of students to help us with the actual measurements and a bunch of behind the scenes work. Erica Block and her team in food nutrition services have been absolutely wonderful with this. And of course, our sustainability team at Rush. Next slide. So as we started digging into this, the initial push from our side of things was for landfill diversion. And it was really interesting to learn that Erica had a really big passion for prevention in this. And it was a great kind of collaboration because of that. We took a tour to the biodigester Green Era down on the south side in Auburn Gresham. We signed a letter of intent to support them with material a long time ago. So it's really exciting that that's coming to fruition. Hopefully they'll be running, I think, in around the middle of the year, which is really exciting for us. But this is our group of students, faculty collaborators, food nutrition as well. Next slide. As we went down there, as we started in on this process, it was really great to see that the students kind of take it and run with it. They created some really amazing documents as part of their work with these volunteer hours. And they created literally a protocol for how to do the sampling. They worked with Food Nutrition Services. It was a really great opportunity for them to create maps so that they could share with everybody else who was going to be collecting data. And it was really fantastic of them to not only do this, but it was a great experience for them to have back of house experience. Next slide. That they may not have otherwise gotten to have. Chef Dustin has been awesome with this as well, our executive chef down in the central kitchen. He helped us out with training, kitchen etiquette, make sure that we were abiding by rules and regulations down there. And this measurement started, our project started almost a month ago, and it actually is continuing through this week and into Friday when we will take our last measurement. So we'll have a full month's worth of data. Next slide, which is really exciting for us. We use the red cap system. which is kind of an internal data management, or I guess project management system. We created and built out an entire project in here so we can tick the time, the date, what time of day our pickups were, what the main constituents of the food waste are, the weight, etc. And then one last addition was the pictures, which was really interesting. Erica and her team wanted, you can go to the next slide. Primarily, again, to push us into that space of prevention, right? How are our cutting practices, right? Are we leaving a ton of watermelon on these rinds? Do we need to do retraining in that space to make sure that we're minimizing what we're generating in the first place? So these pictures are literally worth 1,000 words and have been really interesting to see as it's tied to that project. Next slide. So we've got about 4 weeks of data so far, which is really exciting. We get these weekly data report outs, which are awesome. We're generating between 500 and 700 pounds on the production side of things. And this data is going to be absolutely invaluable because we're going to use this not only from a landfill diversion perspective to help us understand the logistics of getting our material to and from, but also it's really, really exciting to see what's going to happen on the prevention side of things. As again, this data is going to be very helpful for that. Go ahead. Next slide. And then next up for us, we kind of did the low-tech version of Lean Path with this project, which is really kind of cool. But Lean Path is on our horizon. We've had it kind of pushed off because of COVID and some other things, but we are going to go into that space, and we know that they have some really great reductions that come from this, again, on the reduction process, the prevention side of things, to help us kind of get into that source reduction and really drill into opportunities for improvement across the board. So we're excited to kind of automate that process, make it a little bit easier on us. But again, this measurement is going to give us lots of visibility. We're hoping to potentially publish a study on this and do some really great things, again, in engaging with our food nutrition services team, the students, our faculty, and our sustainability team. So with that, I will pass it on. I think we're done. That's my last slide. Thanks.
Thank you, Ian. You packed a lot in. You guys have really done a lot, both in terms of measuring and prevention. And I love that you were talking about all the different connections that are made between different departments within the system. Thank you. Next, I'd like to introduce two of our presenters. Jen Grenier is from the Associate Chief Nursing Officer at McNeil Hospital. And then we also have Nikki Wynn, who's the Manager of Nursing Excellence and Magnet Program Director at Loyola University Medical Center. The really fun thing about Jen and Nikki is that they've been working with the Surplus Project through multiple hospitals. It's a project that started in Oak Park and Rush Oak Park Hospital and was taken into the city. And it's something that they're going to tell you about. This really cool program that it looks a little bit different at every hospital and with every partnership. So I will turn it over to Jen and Nikki to share with us. Welcome.
Thanks, Jen. And nice to meet you, Ian. I worked at Rush. Nikki and I worked at Rush. I worked there 20 years where we first officially started the Surplus Project. So it's really exciting to see how you're expanding on things. Nice to meet you. Next slide, please. So the Surplus Project, so here's our data, right? We all know it. Growing number of individuals are food insecure, leading to increased health disparities for our patients. And it's linked to diabetes, CHF, all the data that we know that we've seen for many years. So, I was part of a leadership development program at Dominican University when I was at Rush Oak Park at the time. And we said, what can we do? What can we do to help? I was paired up with the Oak Park River Forest Food Pantry, the executive director at the time. And that's where kind of Surplus Project started back in 2016. Next slide, please. It was our mission and vision. It was aimed to improve the nutritional health of our community through the distribution of surplus food from hospital cafeterias to food insecure individuals and families. So when we were first trying to come up with the idea, we thought, all right, if you guys know Oak Park, the street at Oak Park, we got a lot of nice restaurants and bars right there. We're like, let's go hit every restaurant and bar and see if they could donate food to us. Well, would have been huge and a ridiculous project to try to do. And so we said, what about our cafeterias? Has anyone looked into, I'm going to start at Rush Oak Park. We had a beautiful little cafeteria there, and let's see what we're doing there. And it all started when, I'm sure many of you do this, when you have the hospital parties, when the senior leadership is in the back and, we're serving up the food and all that for our hospital team. I was appalled then when I was on the cleanup crew of how much food we were throwing out. I mean, vats of ham and mashed potatoes and all that. And we said, we got to do something better with this. And that's where I paired up with my friends at Oak Park River Forest Food Pantry. And then when we went to Rush, my friends at Franciscan House. Next slide, please. And so Nikki's going to talk about the social determinants of health and what we're seeing in our neighborhood. Very similar to what many of us are seeing.
Thanks, Jen. So for social determinants of health, you guys all know what they are, I'm sure, but it's basically how people live and what they're affected by, and they're shaped by money, power, and all the resources that they have. So the one that we obviously focus on the most is food insecurity, but we also know that food insecurity is affected by the other SDOH indicators that we've seen, housing and transportation, and so forth. So the map on the screen that you can see, I'm sorry that it's small, but what we want you to focus on is what's in that black box, which is the west side of Chicago. And that's where we focused our efforts towards, because we wanted to ensure that we could make a difference in the community with our project. So when we worked at Rush University Medical Center and Rush Oak Park, and now here in the Loyola Medicine System, we're serving the same West Side neighborhood to help be collaborative and connect with the community and help with their food that they get. Next slide. So why are we implementing a project like this? What's the impact? Especially now since COVID and the pandemic, we're seeing an increasing number of food waste in the hospital, but also we're seeing a lot more people suffer from food insecurity. And we really want to ensure that we're addressing these social determinant of health needs now more than ever, because people are struggling even more. So with the implementation of this program, our main goal obviously is to decrease the amount of food going to landfills and help people who are hungry more often than not. So the graphic at the bottom shows that from where McNeil Hospital is located in Berwyn, there's a 14.6% amount of people who are food insecure, which is very similar to all of the United States, which is a big percentage. Next slide. So what is our process? How do we make this work? We work with an interdisciplinary team. Jen and I, both being nurses, have worked very closely with food and nutrition at all levels, as well as our case managers and social workers, to ensure we're connecting with the right team in our community. And once we make sure that we have the right partner for our community health and well-being partners, we then find a way to donate. What do they need the most from us? And whether it's individualized meals or big pack or big vats of food that they then repurpose, it doesn't matter as long as they're getting what they need. We got approval from all of our leadership teams, asked them what they thought, had to give our ideas, and right away they all said yes. We've never been told, no, this won't work, or no, you can't do this. Everybody's interested and wants to be part of it. We educate our food and nutrition staff to help show them exactly what we're doing and what the process is behind it with collecting the food, making sure that it's labeled and distributed in a timely fashion. And then once we work with the recipient site to make sure that they get the benefits that they need. We recruit volunteers, and at first we were nervous that we wouldn't get what we needed, but typically our volunteers start anywhere from 50 to 100 people each time, and it just continues to grow as we see success with the project. Next slide. And this is a little bit more details about it, but our biggest goal with this is that we include people in the hospital to ensure that they know what we're doing, and by packaging the food, what we're getting in our return on investment. We're helping people to not be food insecure and helping people to feel like they're being successful in the community. Next slide.
Our current state, I got our 2-minute warning, I'll be fast. We have 14 hospitals across the United States that are doing the surplus project. Some of my advocate friends are on here. I see we have that going at Christ. And we expanded at Loyola Medicine to a Heinz VA. You could see Heinz right there in the right. And that's where the veterans were coming and picking up the food. Especially during COVID, we expanded to McNeil, we expanded to Loyola Medicine, we're expanding Gottlieb, and I just recently heard an email right now, one of our partners at Trinity Health out in Pittsburgh has expanded the program. So, and we received a $50,000 grant from Trinity Health to continue to expand our program and provide resources. We have toolkits. We could send everyone the toolkit, show you everything that you need in order to get the program up and running. And these are just some helpful links. We love to make videos. We got the Rush video in there. We got the McNeil video in there. Beyond Hunger and the Surplus Project is probably my favorite one. It's a little bit longer. So when you have some time, sit down and, have a look at that. But these are all my partners from Rush and Loyola and Hines, and would love to partner with anyone else to get the program up and running. Thank you.
I feel a little awkward being the one to introduce Luana. I mean, maybe that's something I should have had you do, Jen, but unfortunately, Luana has connections with so many different hospitals right now. It'd be hard to pick who would introduce her. Luana is the director of shelter operations for Franciscan Outreach and has been a partner to both Rush University Medical Center and University of Illinois Health, and has been one of the organizations that's been able to not just accept food to provide that food to people who need it, but has been a really active partner in that process in being able to speak to what they need and what they can use and what would be appropriate. So Luana, I will turn it over to you.
Thank you, Jen. Luana Johnson, as she mentioned, Franciscan Outreach. I'm the Director of Shelter Operations. Just a little background, Franciscan Outreach is a leading provider of homeless services in Chicago. We operate as a system of support for men and women who are marginalized and homeless. We empower people to gain the stability they need to transition into permanent housing. As Nicole mentioned, we know that food insecurity is one of the main issues that homeless individuals and families face today. Next slide. Food insecurity rates are highest for single mother households and households with incomes below poverty line. Food insecurity means you lack reliable access to a sufficient quantity of affordable, nutritious food. Next slide. Just a mile away, I don't know if you guys are aware, we are in the Garfield Park community, and Aldi's just abruptly closed its doors. People who live in food deserts often experience food insecurity because food is harder to get to. As a result of food deserts, many people do not have access to healthy foods, leading to malnutrition and vitamin deficiencies, which have serious consequences. Malnutrition is the cause of almost half of all deaths of children under 5 and the primary cause of many chronic diseases in adults. This also leads to a shorter lifespan for those in poverty communities like the East Garfield community than in other communities in Chicago. Food insecurities and food deserts make it essential for survival of many people that rely on food rescue programs. Next slide, please. Hospitality. Hospitality is one of Franciscan Outreach's core values. So what happens is when a new client or a returning guest arrives to our shelter, the very first thing we do is assure that the guest is able to shower, change into fresh clothing, and eat before intake. As we understand that most times the guests have been out on the streets with no food to eat. The food that we receive through food rescue programs provide an opportunity for us to have readily available food choices for our guests outside of regular service food time. Although we are not a soup kitchen or pantry, Franciscan Outreach is a beacon of hope in the East Garfield Park community. Oftentimes, the food items we receive through food rescue programs, we are able to share and feed our neighbors who may just need a few days of food to get through until the link card is restored. Next slide. And so it is essential that we continue to work together. Food rescue programs that we receive, like through Greater Chicago Food Depository, that rescue food, I'm a little nervous, rescue food from major brand companies like Starbucks, Rush with Panera Bread. The guests absolutely love when Panera Bread comes through the program. UIC, High-End, and many other food rescue programs. You guys have been Franciscan Outreach's strongest and most reliable donor partnerships. The guests are able to get fresh vegetables, fruit, and snacks, which are some of the food items the guests are not otherwise privy to when out on the street. Franciscan Outreach rely on food rescue programs and are especially grateful to the programs that service our guests. And as mentioned, Rush, UIC, the the Greater Chicago Food Depository, just to name a few. Thank you.
Oh, thank you, Luana. I love the part that you talk about really making a connection with bringing healthy food to neighbors that don't have access to that, and then bringing a diversity of food that's enjoyable and something that people would look forward to eating. I think that segues very nicely into our next presenters. I'd like to introduce you to two presenters who are coming from the Chicagoland Food Sovereignty Coalition, which is a sisterhood of mutual aid organizations that have come together really in part of the pandemic emergency response to organize around food on a really hyper local level. And you heard from Luana talking about what was in place for Franciscan outreach. Both Cosmos Ray and Graciela Guzman, who I'm going to be introducing now, work in a hyper-local way in their own mutual aid organizations. Cosmos Ray is with Bronzeville Kenwood Mutual Aid, and Graciela Guzman is with Belmont Cragen Mutual Aid, the Northwest Side Mutual Aid Coalition. But then they come together in partnership with many others that are working on coming together so that they can accept larger donations of food, aggregate them in food rescue hubs, and then be able to work together to get that food out to their neighbors. So I will turn it over to Cosmos right now. Thank you for being here.
Thank you. Greetings, everyone. Graciela had an emergency at work, so she will not be joining us, but send us some love if you can. I appreciate all the previous speakers because I think you illuminated a lot of perspective. I think I'm going to come at it from a little more of a conceptual perspective. I think in a lot of spaces in this country, we are taught and conditioned to disconnect ourselves from our whole being. And so I think it's really important at any juncture, any chance that we have to really bring our wholeness to spaces that, obviously you don't want to bring all your baggage, but I think we're taught so much to filter who we really are. And I think that's to the detriment of the possibilities of connection and engagement with one another to make this world a lot better. So I would flag that we bring our wholeness to all these spaces. And as it relates to wasted food, I think that's another perspective where there's a disconnect in our food system such that it's predicated upon waste, profit, and food apartheid. I would say that food apartheid is deliberate, which some people refer to it as food deserts, but this is a systemic issue. And it's based on decisions with people that have power and money. The Chicagoland Food Sovereignty Coalition is a little bit of we always joke with ourselves, like, do we choose too academic of a term? Sovereignty in this case is a response to the binary of food insecurity and security. It's important to definitely work against food insecurity, but I think what we see with food security is it's the same power brokers at play. It's the same people that have the assets and they make the decisions on who and when food can be accessed. So food sovereignty is the notion that we democratize, that we allow for each person to have a choice and a voice in the food system, to really reimagine what that looks like. And from a food rescue perspective, the coalition, as Jen alluded to, is a roughly 30 groups, autonomous groups across the city and South and West Cook, who are working to reimagine that system locally and then hopefully regionally and nationally to have more participation. I think folks were saying that a lot of us are experts. I'm probably the least of an expert here. I'm more of a participant. And I think that's maybe the point, is that the more each of us participates in systems that have failed many of us, the more opportunity we have to reimagine them. We don't have to leave it up to government or some other network. I think you can start on your own block. If you're engaged with your neighbors, you can readily reimagine how things are, and really through each of your gifts, you can provide for all of your needs. That's one of our mottos. So with the coalition, just to highlight a few things, I know I have 5 minutes, I got a stopwatch in front of me. We do 13 weekly recurring food rescues plus ad hoc offers. We get people that reach out and say, hey, we got this food, can you come and get it? We lean into food rescue. As mentioned, food sovereignty to me is an umbrella that includes compost, food rescue, growing food, food co-ops, free stores, political education, nutritional education, teaching people how to cook, all that good stuff. So food rescue, as we're identifying it today, allows our groups to procure viable and nutritious food with little to no capital. We are renting or leasing 2 food rescue hubs right now. We just expanded to a second one on the northwest side. We have one in West Pilsen. And that allows us to get a little more flexibility with scheduling across all of the various activations our neighbors have. So we're looking to expand those food rescues. Some of the great people on here are also have been helping us, but if you're a group that has wasted food that's still viable and can be redistributed to those who have need, we would love to talk to you about that. I didn't do a good job of telling you to move the slides, but you were very intuitive and did so I appreciate it. As you can see, if you want to donate your time and skills, we have a volunteer bit.ly. If you want to donate food, it's the CFSC food donation. I guess we can link these later. And if you don't have time, but you have some money and you don't have food, you can always donate funds. And then you see our website there. And by my watch, I'm right at 5 minutes. So I appreciate the opportunity to speak to you today.
Thank you, Cosmos. And thank you for being here. I think one of the things that I want to talk about in terms of the Chicagoland Food Sovereignty Coalition is that idea that this is about building relationships. This is about building equitable relationships and really open back and forth relationships between the community organizations, the community organizers, and the neighbors around each hospital and healthcare system. And I think that that's something that we all need to be working on in every system is how are we coming together, not just to meet the needs of our neighbors, but to also change the way that we're thinking about the food system. So thank you for being here. I think I really appreciate this. And I'd like to just send a shout out that there are mutual aid organizations all across the country, all across the world. So for those of you that are joining, not from the Chicagoland area, this is a really exciting opportunity to explore a connection between a hospital and a mutual aid organization and being able to have that connection directly with neighbors. So without further ado, I'd like to introduce our next 2 presenters. We're going to be talking about composting. And so you have prevented all of the food waste you can, you have rescued all of the food that is edible and can go to people. So what do you do with the rest? We heard from the survey that we've only got 1 of those respondents that's doing food scrap composting. I have a love of food scrap composting, as I know Erlene does, and she'll be telling you about that in a minute. But first, I'd like to introduce Mary Nowinski, who's the Director of Clinical Nutrition, the Director of Food and Cafeteria Services at the University of Illinois Hospital. There's a partnership between UI Health and our other speaker who's coming to join us, who is Erlene Howard from Collective Resource Compost. So Erlene's business is as a compost hauler, taking those food scraps and making sure that they're being processed back into nutrients for our soil. So I will welcome both of you and turn it over to you.
Go ahead, Erlene. Yeah, so basically, I'm thrilled to be here in the conversation that's already happening. We're always way above feeding people over creating new soil, but we want to do it all. So so compost makes everything better, and partners equal solutions, as we're seeing today. Next slide, please. So how did we get here? I had a personal desire to have a composting service, and I thought if I made it easy, more people would do it. And that came right in alignment with the state of Illinois passing State Bill 99, which made it legal to keep the food scraps out of the landfill. And I didn't even know that it was illegal when I decided that I wanted to have a composting service. So I started hauling in June of 2010 in the trunk of my Camry. And it took a while, took about 10 months till we got our first truck. And then we started to work with restaurants and cafeterias. I had been connected with UIC and the sustainability director there just through different green initiatives along the way. And they, from the student center, they were having some challenges with a tipper model collection of food scrap composting. So we'll get into that a little bit more. They wanted to move into a container swap model. And so then a year, UI Health was ready to jump into composting, and we had a proven track record at the student centers. So that made it a really nice transition. To date, we've diverted more than 8,700 tons from the landfill from now our 3,000 plus customers. I think that one of the things that a really big picture thing that we need to keep track of is composting our food waste versus landfilling it is the thing that we have the most control over to reduce methane in the atmosphere. The other large producers are industrial farming, and then the actual harvesting and transporting and transferring of the actual fuel, which lets methane go into the air. So 17% of the methane production comes from the food in the landfill. Next slide, please.
So we got together because, like Erlene said, she was already in the Student Center West, and our CEO at the time was super excited about getting involved in waste prevention of food. And so Joe Ossebaker from UIC Sustainability got in touch with us, and he put Erlene together with us at the hospital, and that's how we started composting. Erlene is super passionate about what she does, so it was really an easy partnership to make. She's been super supportive of how we do this at U of I. Erlene, you talked about the Wasted Food Action Alliance education, and the first thing we did was we were working with the Practice Green Health as well. So we needed to create a food waste policy anyway, and we did. And we included the composting. So next slide, please. This is part of our policy, and we had a lot of training to do because, as you can imagine, in a food service department with 80 people who, we were trying to teach them all to do the same thing. We had to teach them that they were going to be diverting scraps from the pre-cooking areas, and they were going to be diverting food waste from the pots and pans area as well as from the dish room. Somebody mentioned earlier that patients produce a lot of food waste, and they certainly do, especially when they don't feel well. There's a lot of leftover food on their trays. So prior to this, we were dumping it all in the garbage. Now we have, with Erlene's help, 27 totes that are delivered to the hospital every week. And we're not filling all 27 of those, but between these three areas of our kitchen and the food left over from the cafeteria, we are filling totes. Next slide, please. Trying to hurry here, sorry. So we had to teach everybody what is compostable and what isn't compostable. And like I said, with Erlene's partnership, she was so awesome in helping us along the way because she was able to tell us what was being found in the totes. And so we were teaching people in the kitchen that they wanted to save food and things like napkins, paper towels, tea bags, coffee grounds. We didn't really have too many of those, but those were the things that we wanted them to save. And we wanted them to stop throwing their plastic gloves into the rescue bins, into the compost bins, and stop throwing plastic saran wrap, and stop saving the soup because it was filling the totes too large. Next slide, please. Some of the challenges that we had. Accountability was a big one. And if you can imagine, again, a large hospital who's going to take these totes back and forth to the dock to get them to Erlene's people? Turns out Erlene's people are doing that very well for us. However, we were trying to get environmental services involved. We were trying to get our people to do it. There's short staffing, etc. The consistent use of the totes, believe it or not, as soon as you teach everybody what to do, you turn around and you come back 1 week later and you find out not everybody's doing what they're supposed to be doing. So consistently using the totes in the area where they're supposed to be using it, avoiding the contamination of compost totes. So you'll see 2 pictures there of what Erlene's group was able to take pictures of it and send us, that no styrofoam dishes, no milk cartons, please, no plastic gloves, etc. And then again, stop saving liquids, please, and retrain all over again. Next slide, please. And that's you, Erlene.
Yes, so how it works, like Mary said, we deliver the washed, lined, kitchen-ready totes for the customers to put their food scraps in. We come on a scheduled time and trade out those containers, leaving fresh containers behind so that the customer only has to think about diverting food scraps. Then we take the material off to a commercial composting site, and it is ground with yard waste or Christmas trees, laid out to cure in windrows, so it gets to break down naturally. And then that is used as a soil amendment, and it also improves our air quality because it's not creating all the methane from being in the landfill. We now serve a great swath of Chicago and the northwest suburbs, and have some municipal franchise agreements with Evanston, Skokie, and Morton Grove, and more of those opportunities are presenting themselves. Next slide, please. Why it works. The container swap, like I said early on, there was spillage from tipping the containers. With no dirty containers left behind, greatly reduces any bug problem outside with having the clean totes. The totes are also not climbable by our 4-legged friends unless you give them a boost up of a staircase or a wooden fence. And we continue to do education, 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 and support. So we're here to help work through any problem that is getting in the way of having the compost done well and successfully. Next slide, please.
And UI Health is a success. I want to thank Erlene for that mostly. And there have been 111 tons of diverted food waste in 2019 to 2021. But in 2022, we are on track to divert 70 tons just in 2022. So that's great. We fill an average of 18 totes per week. And best of all, we've really educated people in the department to be aware of composting and appreciate minimizing food waste. Next slide.
So back into the conversation about community regeneration. Through UIC, we are also got introduced to Green Era, and we'll be hauling there. We're also reworking our routes so that we can bring most of our food scraps down to Green Era. Their finished material is going to be feeding into community gardens and creating healthy local food. And with these great opportunities, we can, make a lot of things better, our gardens, our community, and our planet. So, repeat with partnerships. Next slide.
Thank you.
Thank you so much.
Thank you both. I'm going to turn it over to Lucy in just a minute to talk about the roundtable, but I just want to ask if anyone else noticed all the different connections that have been discussed today, whether it was Ian talking about relationships between different departments, or we were talking about hospitals partnering with community organizations, and here we have a business and hospital partnership. But everyone talked about the need to communicate, the need to figure out logistics, and that's what we're going to be doing in our roundtables. Before Lucy tells us about how they're going to break out, I'd like to introduce you to one of our other experts who is not speaking today, but is going to be a part of the roundtable discussions. I have the pleasure of getting to work with Stephanie Katsaros, founder and president of Brightbeat. on so many different projects related to food rescue and food scrap composting. And she's going to bring her experience into the discussion, talking about the way that she has helped municipalities and institutions and businesses start composting programs and look at the logistics involved. So I hope you saved up your questions, because I think it's going to be an exciting half hour of getting to actually talk to the people who've been presenting and making some connections today. Lucy?
Thanks so much, Jen. And just want to echo again, gratitude to all the speakers. I know the last hour was jam-packed with information and it was a full sprint. And I wish we had even more time together to dive into details. So that's why we're going to be doing some time in breakout groups. So as participants, you won't have to do anything. We're going to automatically open the breakout groups. You'll have the opportunity to meet with 2 different sets of speakers. You'll have 12 minutes with each set of speakers, and then the speakers will be rotating through rooms. So you'll either start with a conversation with speakers who specialize in rescue, or you'll start with a conversation with speakers who specialize in food surplus prevention and composting, and then you'll have your speakers rotate. So within the breakout room space, you'll be joined by those speakers and a moderator who's going to help guide the discussion. We really encourage everyone to be active, use the chat, come off mute, ask questions, network with one another, really make that space yours. If you have any questions or comments that we don't get to, please put them in the chat, because all of the chats from the breakout groups and today's discussion will be saved. And we'll be putting together a really helpful document that we'll send out with the meeting slides and the recording that talks about the different questions that came through, and we'll work on getting responses to those questions from our experts. So I'm going to open the breakout rooms now. I will be sure to let everyone know before the speakers get moved from one room to another that you'll have about a minute or 2 left in your conversation. And if you need any help moving to the breakout rooms, please feel free to let me know, and I will be sure to assist you. So we will open the breakout rooms now. Again, we'll be moving the speakers, sending out time reminders, and then just one final note that we'll be coming back to the main session to just share a few final thoughts before ending the meeting at 11:30 local time. All right, I'll open the rooms now. Thanks, everyone. Okay, welcome back, everyone. Thanks so much for participating in the breakouts. We hope you had a chance to get some more one-on-one time with our speakers and connect to share comments, questions, networking opportunities. I am going to start sharing my screen again, and Jen is going to wrap us up in our final few minutes.
You probably don't even need to share your screen again, because it's just that last slide. It's nice seeing everybody's faces. Half of everybody, those that have our cameras on. Thank you, everyone, for your time and for your sticking with us as we went through so much information in such a short amount of time. I'd like to start with a huge thank you to all of our speakers and experts who came in to join us today to make this conversation what it is. And especially to our partners at the Alliance for Health Equity, who not only have been on screen here, but have done a ton of the heavy lifting behind the scenes to make this event possible. And I'd like to say that this is neither the start nor the end of the conversation. We're somewhere in the middle. And we've gotten to learn today from so many different organizations that are working in partnership to reduce wasted food. It is Food Waste Prevention Week. Did everybody know that? We're raising awareness around the country about preventing wasted food. So please consider joining Wasted Food Action Alliance as we are getting out messaging all week. Send out your own social media messaging, bring it up at any meetings that you are a part of this week, because this is an area where we can all make a difference. We can all make a difference in our own lives. We can make a difference where we work, and we must make a difference to make the food system a more equitable one and make sure that we're not having conversations about wasted food, but we're having conversations about making sure that everybody has access to healthy food. And I encourage you to look at the partnerships that were presented today and dream about the partnerships that you can be making in your own hospital and your own healthcare institution. And I have been so grateful to be a part of the conversation. I am looking forward to many opportunities to connect beyond this call. If anybody needs to be connected, don't hesitate. Lucy shared in the chat her email and my email. And if you have a desire to dig deeper into any of these topics, let us know, because again, the conversation will continue. Lucy, do you have any final words you'd like to say before we let everybody back to their lives?
No, just thank you again so much, everyone. Seeing everyone's faces here, having this space with speakers gets me so excited about this work. Just a reminder that we will be sharing the meeting recording, the slides, and then also we'll prepare a document with some of the questions we got today and some answers from our speakers after the call via email with everyone. Please don't be strangers, please reach out, and we hope everyone has a wonderful rest of the week and enjoys the start of hopefully the spring, which at least in the Midwest appears to be on the horizon. So thanks everyone, and have a absolutely wonderful day.
Cheers. Bye, guys.
Thank you.
Thank
Take care,
you.
everybody. Keep up the great work.
Thank you.